Started. So if anybody doesn't know me, I'm Dr. Pam Middleton, your virtual holistic pediatrician. And I wanted to come on and give information about COVID-19, like the updates, because I've been seeing all kinds of craziness going on social media. And I have been talking to colleagues, and we really feel like the general public is not aware of how serious this virus really is. So, I wanted to give you that. I don't want to panic you or scare you. I just want you to understand what you're up against and, give you some tips for how you can protect you and your family. Okay. So the first thing, and this is something that recently came out, we now have data from the first wave of cases that are not associated with travel from China, or anywhere else. This is community spread data. So we have known for a while that COVID-19 was here and was being spread in our communities. The problem that we've been having, our numbers still, as much as they're rising, they're still not accurate because we don't have testing everywhere. I know in California, there's probably a bit more testing because there are more cases in California. So traditionally, what's been happening is there seems to be more test kits available in the areas that have the highest rates of infection. But it's still not, everybody can't get tested. Even people who are symptomatic are not always being tested. There are a lot of areas where you have to be hospitalized in order to be tested. So don't necessarily look at the numbers out there and think that they are accurate. They are lower than what the numbers are. And that's actually what makes this virus really scary, is because a lot of people who have it are asymptomatic or just have, kind of cold or flu type symptoms. So one of the things that, one of the problems and why that is happening is that you can also be an asymptomatic carrier for like 1 to 14 days before you get symptoms. So you can be exposed and you're a carrier, but no symptoms for up to 2 weeks, which is why the 2-week quarantine has come into effect. Now, I will admit to you guys that it will get worse before it gets better, because right now we are trending ahead of Italy in numbers. And that's been what we've been really trying to avoid, because we know from colleagues in Italy that, it's their medical system has become overwhelmed with this. And this is what we don't want to happen here. We don't want it to get to the point where the amount of people who are really sick, who need ventilators, just can't get them because we don't have enough. And so, and unfortunately, the other problem that I'm realizing that we might run into here is a lack of healthcare personnel to take care of everybody, because, I'm very aware of this. I don't know if you guys are aware of it, that most of your healthcare providers do not have adequate protection to protect themselves against this virus. So you've got people in the emergency rooms who are working with what we call PPEs, personal protective equipment, that is supposed to be used once, but they don't have enough, so they're having to clean it in between patients themselves. This is not good. And it's my understanding that the CDC today actually said that if you are working in a hospital or a healthcare facility and you have run out of masks and other PPEs, that you can just tie a bandana around your face. I find that to be extremely ridiculous. But if this is what's happening, your healthcare providers are going to start getting sick. And then there will be nobody to take care of folks. So, there's just a lot of things that are going on right now. So staying home and self-quarantining is actually the best way that we can decrease this thing, slow it down so that all these people don't get sick at the same time. A lot of people are going to get sick. Most of the people who get sick are not going to need to be hospitalized, but that percentage that will get sick enough to be hospitalized, we really have to slow that down. We don't want it all to happen at one time. Now, the other thing that's going on, everybody was told that, well, everybody can get sick, but only the elderly people or the people with underlying medical problems will probably, have bad outcomes. Well, that's not totally true. It's partially true. I mean, they are at highest risk, and they are going to be the ones who have an increased risk of dying. But right now we're looking at numbers of that 40% of hospitalized patients are aged 20 to 54. So I think that's a number that was shocking to a lot of people, because you're thinking that, especially if you saw the pictures of like all the young people on the beach in Florida, they're all thinking, we're fine, we're really not going to get that sick. But they're not thinking that some of them might. And even if they don't, you're going to go back home to your parents, your grandparents, who, you can actually get them sick and they may have a bad outcome. And when we looked at those who were hospitalized, like 20% of those and 12% of the people in the ICU were actually between 20 and 44. So officially the millennials. So they really have to watch out also. And one other thing that I want to bring to your attention, this is another new finding, because, originally when it came out, you were told that, the typical signs of the COVID infection was the fever, the cough, and the and difficulty breathing. Well, now we're seeing some people are actually presenting with GI symptoms. And the people who have GI symptoms, oh, let me see. Somebody is saying, if you haven't done so, can you please mute your mic? Okay, yeah, everybody, let me see if I can, I don't know if I can mute. Let me see. I may be able to mute everybody. Let me see. Oh, it looks like everybody's doing it. Yeah, if you can mute your mic, because there is a little bit of background noise. Let me see. I see a couple. Let me see if I can mute everybody. I think I can mute you guys. Looks like everybody. Let me see. Okay. Okay, I think I was able to mute everybody. So now if there's going to be a time for question and answers. And as I'm going along, if you have a particular question, you can unmute yourself and ask a question. You don't have to wait until the end. That's fine. Okay. Now, and I guess I haven't been looking in the chat. You can also put questions in the chat. And let me pull it up so I can kind of see what's going on. Okay, I don't see anything yet in the chat, so I didn't miss anything. Sorry, I wasn't looking in the chat yet. Okay, so where was I? Oh, I was talking about the GI symptoms. So yes, there can be GI symptoms, and what they're starting to see is the people who actually present with GI symptoms tend to have a more severe disease. Now, once again, remember, especially if you've got children, you know that they always got like diarrhea, vomiting, abdominal pain. That's kind of par for the course for kids. So, don't freak out if your child has some of those symptoms. And it's just, and it just could be that they just happen to have that. And we have to remember that children traditionally are the group that has not been having severe disease. However, we highly suspect that children are carriers, as they are with anything else. Kids will get you sick all the time. So it's nothing different with this virus. So children may actually have the virus and not be very sick. So that's another reason that all the schools are now closed. So if you look at what's being done, even though things aren't being said, like it's not being said that, oh, this is really, really serious and, we really have to hunker down, you can see what's going on. schools are closed. People are being asked to stay in. I think eventually they may even shut down domestic travel. We suspect that that's coming, because what's been happening is that people are being asked to self quarantine, but that's not exactly happening, as we can see from the pictures in Florida of spring break. So, there may be more kind of government reach in the upcoming days, but we will see. And I think it'll depend on our numbers also. Now, this is some of the things I know. I don't know if any of you guys are already homeschooling, but a lot of parents are trying to figure out what to do with the kids now that the kids are home. But the one thing that I can say from a medical perspective is that my ER colleagues have said that they're seeing more children coming in who have had accidents, because the kids are home, and you may have more kids at home than you're used to having at home, and you can't watch everybody at every second. So just try to and if you have a lot of kids, try to get them to maybe police each other, so that nobody is getting injured, because this is really not the time. You don't want to have to go into the ER at all at this time, especially if your child gets sick and has like asthma or can't breathe, something like that, of course you're going to go in, but you don't want to have to go in for stitches or something and then possibly get exposed to COVID-19. So, just try to watch them to decrease the risk of accidents. Also, you want to make sure that you lock up, if you do have any prescription medicine or any medication, lock it up, put it away from them, because especially for younger children, that those pills, they all look like candy to them. They will get in it and eat it. So you don't want that to happen. And cleaning products, you want to make sure those are out of kids' reach. And I know that your house is probably already childproof, but once again, the kids aren't, maybe, if you're not already homeschooling or you don't already have really young kids, you're maybe not used to having them home like all the time the way they are now. And especially now that it was just like quick, like over the summer, you're probably more prepared, but you didn't really have time to prepare for this. It just kind of hit. So, be careful with that. Now, one question that I did get, and it was an excellent question, was what do you do if you or your child actually is diagnosed with COVID-19, but you're not sick enough to be at the hospital? What do you do to prevent yourself from getting sick enough to be at the hospital? So basically, I'll say that you can treat everything symptomatically. The treatment that you do will probably not necessarily prevent you from having to go to the hospital if you're going to be a person who is going to react poorly to the disease. However, look at it like how you treat your colds, the common cold or the flu. You use symptomatic treatment. And since you're talking to me, the holistic pediatrician, I'm going to tell you to do the more natural things. Like there was something that came out yesterday, I think, saying that you shouldn't use ibuprofen or Motrin for fevers. You should use just Tylenol or acetaminophen. So traditionally, I'm not a big fan of Tylenol. However, in this case, I will say, okay, since there's so much we don't know, I think the World Health Organization has now come back to say, no, actually, ibuprofen may be okay. I'm not sure. So what I'm saying is, since we don't really know, don't do the ibuprofen right now. Now, what I will say, because I've always said this, a fever is your friend. A fever is the body's way of fighting off an infection. If you or your child is not extremely uncomfortable, you really don't have to treat that fever. Now, what you can do to treat the fever are use more natural things. So you can use Epsom salt. You can do Epsom salt baths. That will be helpful to decrease a fever. It's not going to drop it like Tylenol or Motrin, but it'll generally bring it down by maybe 1 degree. But 1 degree may be enough to make somebody more comfortable so that you don't have to give anything else. And you can also give homeopathic medicines. Now, throughout everything I'm telling you, I want you to stay at home. So if I tell you about something that you don't have, I don't want you to, like, trying to run out to Mothers or Sprouts, or, I don't want you to have to go out to get stuff. So just deal with what you already have at home. And I'm sure that most of you already have enough stuff at home for colds anyway. If your child has coughing, you can do honey, plain old honey, raw honey is great for a cough. And let me clarify. But if the child needs to be over a year of age, if you have a baby or someone under a year of age, they can't have honey. But anybody over a year of age can have honey. So you can give honey for a cough. For congestion, you can do saline drops, just regular saline drops. I actually like a product called Xlear, Xlear. It's a nasal spray, and what's good about this one is it actually has xylitol. Now I can't remember what it has in it. I think it's wait a minute, I have it right here. So I'm going to look and make sure I don't tell you guys the wrong thing. Xylitol, yes, thank you. Okay, so yeah, it has the xylitol, which will actually prevent adherence of certain microbes to your mucous membranes. So this is good to clear out your nose. Okay, and they said it creates osmosis in the tissues too. Cool. So yes, this is something good to have, and it's something that I've now purchased so that whenever I fly, I do this, because it's always good to have moist mucous membranes anyway, and then to put something in there that to make sure that things won't adhere makes it even better. You can also do like the nasal rinses, so you can do like the saline rinse. So all of those are good for like nasal congestion, and right now it's it's allergy season too, so that's another thing. You want to just wash those allergens away out of the nasal passages. So that's a good thing. And let me see what else is out, because I was trying to think of like things that people might already have at home. I was gonna, I have a list of, all these homeopathic remedies that you can use, but I realize that most people probably don't even have that at home. But, if you've been using them, you might have a few at home. And if you're really, really interested in some of these remedies, they're all listed in my book, the 50 Holistic Treatments for Kids 5 and Under. I have a list of homeopathic medicines that go along with, certain symptoms. So, now let me see, what else was I going to tell you about? Now, just to give you a quick little rundown of some of the things that you might, if you already have some homeopathic remedies at home that you might have, there's one called Cold Calm for kids. There's for kids who are 6 months and up, they actually have a liquid form that you just twist off the top, squirt it in their mouths. It's good for sneezing, runny nose, and nasal congestion. If they're older, there are pellets that you can give them, does the same thing. There's actually also the throat calm that's good for the sore throat. And for a lot of people, that's how your cold symptoms start. You get that sore, scratchy throat. So this will be good soothing for that. And then, of course, there's homeopathic oscillococcinum, which is the homeopathic flu remedy that you give at the first signs of cold or flu symptoms. So that's something that I personally always have handy. And do you guys all have my 5 must-have home remedies? Because that's listed there, and that's something that's free. If you don't already have it, you can just go to www.drpam.gift, and I will let me see, I can actually put it in the chat for you. and you can get that, and it'll have those remedies. So even if you don't have it now, you can, oh, you got typed it for me. Thank you so much, Carrie. So yeah, so that's, you know, it has some of the same things that I'm talking about in there. And it actually, I kind of show you how to use it if you hadn't used it before. So that's something else that's available. Now, I've been talking for a while. Do you guys have questions? I'm going, well, you know what? Unmute yourself. If you have a question, go on and unmute yourself and ask your question. No questions? You guys?
I have a question.
There you go, Bridget.
They keep saying that it's mutated since Italy.
Yeah.
Do you think that's the reason for the GI portion?
It could be, or that could have been happening in Italy too. You know, it could have been happening in Italy also. And because we're getting information, but I don't think we're getting everything. In fact, one of the colleagues who was sharing with us the issue with the ventilators was saying that they were told not to share that information. But, you know, he just thought that we needed to know what we may be up against, but, you know, made us promise not to use any of his information because he really wanted to keep his job, you know. So, yeah. So it could have been that we just didn't have that information, or, you know, viruses do mutate. So, yeah.
Also, second question, it sounds like it causes pneumonia, so we mostly have to focus on the care of keeping it from turning into pneumonia.
Yeah,
kind of preventing the
getting to the lungs. But see, like I'm saying, there's some people that, you know, there's not really a way to prevent that from happening if your system is susceptible to that. You know, you can do all of the supportive care, but if your system is more susceptible, it's going to happen, and, you know, you're going to be the person who has the more severe outcome from that. But like I said, you know, the first sign of anything going on, you want to, you know, make sure that, well, the basic things that I guess I didn't talk about this too are, you know, the basics like making sure that you're well rested, hydrated, eating healthy foods, not doing a lot of sugar. So you want to keep your immune system, you know, boosted. You can also give vitamin D3. I love D3. None of us have enough D3. Well, that's not true. Some people have been taking D3. So if you've been taking D3 and you've been getting your levels checked and it's, you know, it's kind of high normal. I have really had people who were high, but I have had a few. But do the D3, and you can also do vitamin C. That's the other thing that came out recently was they were saying that you shouldn't do, what was it? What is it you said? You shouldn't do
I heard elderberry.
Elderberry. And, you know, and I have a colleague who is a naturopath, and she sent me a study that basically said that you could do the elderberry because you weren't going to have, you know, it would take a whole lot to have the cytokine storm that they were talking about. So I said that I would tell it to you guys, like in the Zoom room. I didn't want to say this like on a Facebook Live. So I personally am doing elderberry. However, what a lot of colleagues have said is, you know what, since we don't really know for sure, to be on the safe side, you can stop. But I would say just make sure you're doing the vitamin D3. You know, that's like really important. And then, you know, you can do the vitamin C also. And as far as how much vitamin C to do, you do it to what we call bowel tolerance, meaning you take it until you get the runs. That's when you know you have too much, and back down a little bit, and then that's it. So, and I admit I'm not doing vitamin C. I'm actually just doing vitamin D3. So, yeah. So and then also resting well. So, you know, your kids are generally resting well, but now, you know, you're probably not resting well. and you're stressed out because you're looking at the news, you're looking, every day something new is coming up. So, try to do some things that will de-stress you, whatever that may be for you. And if, looking at the news or looking at Facebook or whatever, you may need to just take a little break. What I suggest for people, because you kind of want to know what's going on, you may pick like one time of the day to go on and figure out what the latest updates are, and then that's it for the day. And instead of like constantly watching stuff, because that is not going to be good for your stress levels or your immune system. Okay, so any other questions?
Hi, Dr. Pam. It's Carrie Ibbotson. I want to say first, thank you so much for doing these. These are so helpful. I think especially in a time when all of us feel so isolated with one another,
Right.
It's so refreshing to have like a medical sound peace of mind there to go, hey, I have this question. Can you help me understand it? I think it's really helpful, and I'm really thankful for you for doing this.
Oh, you're welcome.
Are you going to do more of these?
Yeah, so what I've been doing, and I decided to come on here because, Facebook keeps on changing their algorithms. So I've done like Facebook Lives on, my Dr. Pam page. I've done them on, in the Holistic Huddle group. And it looks like yesterday I did a Facebook Live that I saw, like I had a whole lot more people who seemed to see it than normal. But when I go into my, Holistic Huddle group, it'll look like only a few people even saw like something I posted. So that's why I decided I was going to see what would happen if I did like the Zoom call. So I don't know, but I've been kind of going all over the place, and I'm looking into, there is a program, and I just need to go on and like order it or whatever. There's a program where I can post like multiple places at the same time. I have to figure
it out. Is it Be Live? Is that the one?
No, it's not Be Live. I know about Be Live, and I did have Be Live once, but I don't know. It didn't.
They're 2.0 right now. I wouldn't even bother. But I do want to ask you another question. Are you doing any like nasal breathing type exercises, or have you looked at? I was talking with an ER girlfriend of mine today, and she was talking about how when they remove patients off of incubators, what they teach them is like a big, deep, full breath and then a cough. And they have them do that like once every hour to get their lungs working.
Oh.
And, I think I do oral health coaching. So I do a lot of stuff that has to do with cavities and gum disease and stuff like that. But I work a lot with this nurse because it just so happens everyone that has cavities also more than likely has a mouth breathing issue, and that's triggering the cavities and the pH. But I think the breathing thing, especially for kids and moms, while we have them, everyone's at home and we've all got our kids in front of us. And if we can learn to breathe better, that's going to clear our lungs, but it's also going to clear our brains too, because our anxiety comes from when we're breathing through our mouth.
Yes.
And our pleasure centers come from when we breathe through our nose. Okay. So I was just wondering if you were like incorporating any of that yet into your medical stuff, especially because this is a bronchial, virus issue.
Right. No, I haven't done that, but Carrie, you are more than welcome to educate us about that. Are you in my Holistic Huddle group?
I don't think I am not in your Holistic Huddle group. I would love to know more about it and get in there. I am one of I saw you in Newport.
Okay. Yeah.
So that's how I'm connected with you.
Okay, perfect. Yeah, I do. I have a Facebook group called the Holistic Huddle. And so my vision for that group when I started it was something like what we're doing right here, where I can come in and, I can talk, parents can share information, because it is for holistic minded parents, because my Facebook page, it's kind of for everybody, like everyone. Friends are, so many people on that one, but the group is, a little bit more contained. And so I really wanted parents to start to talk among each other. But like I said, Facebook keeps on changing the algorithm. So I'm like,
it's crazy. Yeah.
how many people are even seeing stuff? I get so frustrated.
Well, I think with this, you have power and autonomy to be able to say what you want. And as long as you have everyone's email, you can send them replays. And if you just keep showing up like you're doing, they'll continue to come to both places. It's just being there. Yeah. So I have a Facebook page as well, where we talked about this today. It's over on Carrie Ibbotson RDH is my Facebook page.
Okay.
And Julia Worrell, who's an ER nurse and a breathing specialist. I've turned into an airway specialist only because, like I said, I was a hygienist and I really wanted to coach the consumers into how to stop cavities and gum disease. And so I would teach on products and tools and techniques. And just over the last 8 years, I've really just honed in on the whole airway and tongue tie related issue and a deeper understanding as to why it's happening. Right. And how to correct it for our kids, because it's a big problem for our generations too.
Right. Okay.
Yeah.
That's great. Well, I'm going to have to go and check out your page because I love it that everybody is really coming together and
that's the point right
trying
now.
to support everybody through this thing. And now that most people are at home anyway, you got time.
You got time. We're finally starting to sleep a little bit better. I loved how you talked about the D3. I think that's so important because we're so D deficient. And if our Ds aren't working, then our Bs and our Ks can't work. And then that messes up our sleep. And I don't think we understand enough about sleep hygiene. There's so much that even me as a provider and as a constant learner, I'm still baffled at all the sleep hygiene stuff and the screens but we do have these moms right now and we can't get in to see our providers, right? Like we can't go anywhere. So we might as well figure out how to get online and get together.
Oh yes. And that's the other thing. I'm glad you said that because I was supposed to say this too. So, I used to do telemedicine and then I stopped for a while. And now I'm bringing it back at least for a while. So it's officially back. I sent out an email. The email that I sent out actually had the link to my schedule, which I actually had only put in for today and a few for tomorrow. So probably I'll have to put some things in for next week because
that's great
tomorrow, so I may take some of those out. But that is available, and I think I'll post that again on like all of my groups that's available again.
I think people will be really excited to see that because then you don't have to all of the things about getting to a doctor, right? And you can just get, I do this with oral health coaching too, and it's really helpful for the moms because it's just tough.
Yeah, it's tough. And now we're telling you, I'm telling everybody, you don't want to go in. I hope that everybody does have a pediatrician or a primary care provider that they can call, because right now the thing is, when you're concerned, even if you think your child needs to be seen, you really need to call first, so people can tell you what to do. The last thing you want to do is just walk into an office because you don't know what you're walking into and they don't know that you're coming. So even if you suspect that you might have been exposed or your child might have been exposed, you don't just want to show up to the office without them knowing you're coming.
Right.
And I know a lot of offices, some of the offices are now, even some of the primary care offices, they're closing except for they're just doing like telemedicine now. So, it's a lot's changing. So we just have to get through it. We will get through it. But like I said, it's going to get worse before it gets better, unfortunately. Yeah. And unfortunately, what I personally feel is going to have to happen for people to take it seriously in a way is that a young, healthy, famous person is going to have to get sick and die.
Yeah.
Before people really say, oh.
And not what you would hope for whatsoever, but.
Right. I don't want that to happen, but I feel like that's what will, because right now what we're seeing is the famous people are healthy, like the people who, like Tom Hanks and his wife and Idris Elba and the NBA player, they're all positive, but healthy. And so people are looking at them going, see, it's okay. It's, it's a hoax or whatever. And I'm like, no, it's not.
It's just not here yet, so no one can really see it. And I think that so many of the cases will, in fact, be mild. But if you do these things like the D and the vitamin C, if you get your selenium, right? If you're having like some almonds every day, if you're having some Brazil nuts every day, like get your immune system up and make sure you're breathing through your nose. Get your mouth shut, get your kid's mouth shut. And it sounds so simple, yet it's really hard. Like people should really try and tape their mouth shut and see what a challenge it is to nasal breathe and keep that up. And if we're breathing through our mouths, we're breathing in all the bacteria, all the funguses, all the everything that goes straight to our lungs, versus when we breathe through our nose, we get that filter. And that's why when you were talking about that clear, I was like, yes, I love to hear that she's talking about the clear, because you can get it everywhere and it works so well. And we should all be washing our noses. And if we wash our noses with xylitol, it'll create osmosis at the same time, which gives you more breathing space.
Right. So that, and I think that's the issue with a lot of kids. They're doing mouth breathing, especially if they've got large tonsils and adenoids,
Well, and that's why their tonsils and adenoids are large, because they're breathing through their mouth. And so they're drying out, and inflammation is the first line of defense, right? So
it's rough. And, allergy season is here. So, a lot of people just, they can't breathe because, when I'm examining the kids, I can look up their nose and I can tell. I'm like, so it's kind of hard for you to breathe with your mouth closed, isn't it? They're like, yep.
Well, it's like a muscle, right? And again, I think that's what a great thing right now is, that we have these moms on. And I know that there's still a bunch of moms on here, and I'm sorry I'm manipulating all the time, but it was just so refreshing to talk to you. And, if you ever want to put your, when you're putting yourself out there, if you want me to post it on my groups, I'm happy to post like your link and say, come join. And if you want to talk about this in your Holistic Huddle group, where we can, there's so much cool things. And I love that you're doing telemedicine, and I don't have anybody else that I've really fallen in love with. So if I have you in my back pocket, I just feel much safer knowing that there's someone there. And I think that most people that have seen you would probably say the same thing. So thank you for doing that.
You're welcome.
It's nice that they lifted the fines for telemedicine. So now it's going to open the doors for people to do a lot more. They just changed a lot of the bans that were in place for telemedicine because of the problems that we're having. So I was just on a webinar with it today, getting that new information.
Well, see, I need to get more information from you, because in fact, there's a webinar going on now that I'm actually missing because they just changed the time on me. But I'll see. It's a group of us who are trying to get together to do like a telemedicine for different specialties.
I can send you a link to a webinar today that kind of walks you through all of it, and there's a company that'll walk you through it. I'm really familiar with it on that end if you need some help. I'm more than happy to send you everything you need.
Because the issue that I'm having right now, like I can do it in California. I was always set up to do it in California, and now they're now saying that we as medical doctors can practice
state by state
stuff across state lines. However, I checked with my malpractice company yesterday, and they're like, yeah, but you not covered for anywhere except California. I was like, okay, thank you.
That's the word that you needed to hear. Yeah.
I think so. I'm like, until we can get the companies on board to say, okay, it's like, so. But, I still get a lot of people like all you guys here, mostly, I get a lot of people from California anyway. So, and, and like I've said too, if you have insurance, a lot of the traditional medical plans are now offering telemedicine services. So just look on your insurance card, and it usually will say that there's telemedicine services available too. So, yeah.
Absolutely.
So that's it. Well, any more questions, ladies?
No, thank you.
I had a quick question. Thank you for doing this first off. I really appreciate it. Question about vitamin D. Does it have to be taken with vitamin K?
It doesn't have to be. I like to have it oral. If you have the oral vitamin D3, it's usually more bioavailable. but they do have a lot of them that are D3 and K combined. I think it helps it to get into the tissues better when it's combined with K. But I will admit the one that I have right now does not have K. It just have D3. And
yeah,
yeah,
mine doesn't either. And I saw something about, D3 with vitamin K, and I was like, oh no, I don't.
right.
I
So,
don't know anything about this, and mine doesn't have it. So am I
yeah,
taking the wrong kind?
if you have but if you're doing like a liquid form, then that should be okay. Okay. But if you had the choice, like if you didn't have any and you're in the store looking, or you're getting ready to order some and you see the D3 or the D3 with K, get the D3 with K.
Okay.
Okay.
I'll get that on my next order.
Right. Okay. Yeah. Okay.
All right. Thank you.
You're welcome. Any more questions, ladies?
No, thank you.
All righty. Well then, you guys go and just like follow me. Make sure that you get into the, the holistic huddle, like I was saying, and I'm gonna try to kind of put stuff everywhere. And as I find more, as I learn more information, I'm sharing. And as I was saying, things are changing almost daily. So whenever things come out, I will share them. And I really love sharing this information because there's so much false information out there. So I'm trying to, it's like if we can just put out the real information so that, folks won't be believing crazy things like sip water every 15 minutes to wash away the bacteria, the virus. I'm like, just drink water. That's fine. Drink the water, but not for that reason. So, yes. Okay, ladies. Well, I will bid you guys good night, and make sure if you hadn't, picked up the 5 must-haves that you go and get your free gift.
Thanks, Dr. Pam.
Thank you.
You're welcome. Good night.
Thank you. Bye.
Bye.